Hi, my name is Awais Paracha. I'm working with Ali Abid and Dr. Dixie Meyer on our project on opiate addiction and ACEs. Almost 2 million Americans struggle with some sort of opiate addiction. And, just as of 2017, we lost about 64,000 individuals to opiate overdose. And our project examines the relationship between that and childhood trauma. And, in 2018, 3.5 million children were investigated for abuse and, you know, adverse childhood experiences like parental substance abuse, emotional neglect, physical and sexual abuse were all linked to opiate dependence. So again, yeah, our project wants to examine the relationship between opiate use disorder and adverse childhood experience.
All right. The rationale behind this study is to examine existing literature regarding opiate use disorder and ACEs in order to shed light onto relationships and correlations that may already exist between the variables as suggested by previous research. We want to expand on that relationship to determine if certain cases of ACEs are more linked to opiate use disorder or other key characteristics of opiate use disorder. This study hopes to allow for development of interventions in order to prevent opioid use disorder in the future. For the methods, a comprehensive literature search was performed on opiate use disorder and related terms. The search was then combined with another search locating ACEs literature. After completing search queries, the study initially identified 21,089 records. Of those, 20,436 remained after duplicates. 20,228 were excluded for not containing relevant keywords, leaving 208 after the screening process. 82 articles were excluded for being case studies and conceptual studies, leaving 126 meeting the eligibility criteria and being used in the qualitative synthesis. This study hopes to encourage new treatments and screening process for opiate addiction. If the findings suggest that trauma plays a role in opiate addiction, then physicians may use trauma to screen patients for a developing opiate addiction. This could help alleviate or diminish the current opioid crisis because physicians can use better screening methods and therefore be more careful when prescribing pain medications to at-risk individuals with past trauma like adverse childhood experiences.